Canada's community e-talk show with our new series, Youth and Mental Health. To recap last week's episode, the connection between substance abuse and mental illness, Dr. Sujoy came to analyze this relationship by looking at the meaning behind substance abuse and addiction, signs of addiction, the importance of substance abuse in mental illnesses, and lastly, how it can be treated. This week for episode 6, Dr. Sujoy and Anu will be having a candid conversation about our new topic, isolation and involuntary solitude. As always, let's head over to our news corner first to hear what Jatin has to say about the news.
Hello everyone, this is Jatin and let's dive into the news in this week's e-talk. 1 in 5 Canadians indicate that isolation caused by the COVID-19 pandemic has had a significant impact on their mental health. LifeWorks' latest survey-based mental health index found 68% of Canadians have had difficulty with their mental health during the pandemic, with 20% of respondents saying isolation has taken the biggest toll. Although the vaccine rollout has led to an improved outlook, many are still exercising caution because of the threat posed by the Delta variant. In other news, a new report by Statistics Canada about increased instances of self-reported loneliness among immigrants is sparking calls for additional data and action to address the issue. Recent and long-term immigrants reported higher levels of loneliness than the Canadian-born. Moreover, loneliness did not appear to be alleviated by the length of stay in Canada, researchers noted in this document. Considering the mental health and physical health ramifications of loneliness, the findings that immigrants report higher level of loneliness pre-COVID-19 justifies continued attention in the coming years as Canada recovers from this pandemic. Moving on, many a time solitude is involuntary and undesired. Solitude can feel like liberation or captivity depending on our mental state. Negative feelings for oneself may lead both to solitude and to loneliness. But changing your perspective on being alone is a step forward towards feeling better, and there are other steps one can take to improve their mental well-being even in isolation. If you want to learn these steps or read any of the news in this section in depth, head out to our social media feeds and you will find links to all of these articles. Now let's head into the unscripted talk segment with Anu and a special guest of the week. Thank you.
Hello everyone and welcome to We Serve Canada Community e-talk. Our topic this week is going to take a closer look into the effects of social isolation and involuntary solitude on a person's mental health. Social isolation is when there is a lack of social interaction, and it can lead to loneliness in some people. Loneliness is the feeling of being alone, meaning people can actually feel lonely without being socially isolated. Social isolation can negatively impact a person's mental as well as the physical health, and it has been linked to many different health concerns such as depression, heart troubles, a weakened immune system, restless sleep, greater stress, difficulty paying attention, and many other things. Social isolation is a prevalent issue among the seniors group as well. So the Center of Disease Control and Prevention stated that the older adults are at a bigger risk for loneliness and social isolation because they're more likely to face factors such as living alone, maybe having a loss of their family and friends, or maybe they have chronic illnesses or issues with hearing, etc. And in social isolation, time also plays a big role. So the longer the period of isolation, the more likely it is for the individual to show signs of anxiety, loneliness, depression, and other mental afflictions. So having actually an alone time is good, but when it is not within our control, it can actually take a big toll on our health and mental well-being. So it is especially important today during the midst of the COVID-19 pandemic to address the concern of isolation and involuntary solitude. People placed in quarantine or self-isolation may experience a wide range of feelings, including fear, anger, sadness, irritability, guilt, or confusion. It is essential for all Canadians to emotionally support each other while abiding by the distancing measures recommended by the government health officials. We Serve Canada has been committed to providing our services and programs to a virtual platform to connect and engage with the community during the stressful time. We have hosted a number of events, including the very successful COVID-19 Wellness Workshop Series, COVID-19 Seniors Wellness Webinar, and much more. And we've received great response for these initiatives, and we continue to strive to provide more needs-based programs to encourage healthier lifestyles for all. With that, let's invite Dr. Sujoy Ray here to discuss more on the connection between isolation and mental health. Welcome, Dr. Sujoy. We've received a great response for all the initiatives that have been done by We Serve Canada, and we continue to strive to provide more need-based programs to encourage healthier lifestyles for each and every one of us. With that, I'd like to invite Dr. Sujoy Ray again to discuss more on the connection between isolation and mental health. Social isolation is not a topic that is commonly actually discussed in today's society, but it goes beyond a feeling of not only just feeling lonely, but it can have a lot of negative impacts as well. So what are some of the main issues, Dr. Sujoy, that are related or associated with isolation specifically?
So thank you for having me here. Regarding isolation, so the thing is that as humans, I mean, we always need somebody, some kind of contact to feel happy about. I mean, if you would study neuroscience in details, you would know about subchemicals in our brains which increase or sort of alter when a person is in company as opposed to when he is alone. And studies are there which have shown that there are certain chemicals, whether you talk about friendship, whether you talk about, say, something like a mother and son bond, or a mother and child, mother and son or daughter bond, or all those things are, all those emotions, all that connectedness or all that connections are directly linked to chemical changes in our brains, and that gives us satisfaction. So that is the reason why social contact is so essential. Now, in isolation, what happens is that we do not have a chance for that kind, we do not have the opportunity to have that kind of a contact, and actually nothing really replaces physical contact or face-to-face contact. Even though strictly speaking, if you have a good internet connection and things like that, you cannot be isolated because you'll always be in touch with your loved ones, and you'll be in touch with the rest of the world. But still, if you are not if you do not have that actual connect with people, it is still difficult to experience the same level of happiness which you would have if you actually had that contact. So when you do not have that level of happiness, or you don't get that contact, it makes the person more prone to develop certain mental illnesses like depression, for example. And apart to escape from that depression, or as to improve upon that, to help in that depression, the person could turn sometimes to things like substances, drugs, things like that. Or even, doesn't have to be drugs or substances. People do tend to get very involved with the internet, smartphones, that kind of a behavior. That behavior itself is sometimes very catching, even though you cannot say that the smartphone is strictly speaking a drug or a substance like that. So these are some of the ill effects which may be seen in cases of prolonged isolation.
Okay, all right. So it is evident that there are some physical health consequences and side effects, like you mentioned, which is linked to prolonged isolation. So could you actually maybe give us an example or explain the connection between isolation and the mental health disorders that might come out through that?
So more the isolation is the person is more prone to get mental health disorders. Um let's say, I mean, usually isolation would come as a result of some kind of a situation, like for example, the COVID situation, which has
Yes.
suddenly pushed people, or isolation does not necessarily need to be a physical, sort of a lockdown where you cannot see others. Isolation can also be social, like for example, if a person's children move out, elderly person, his children moves out or move out, or the family moves out, and suddenly he is all alone. So even though there is no lockdown or nothing like that, it's a separation. So these are all changes. All these changes can lead to difficulties in coping for people, and some some mental illnesses that can arise from it include depression, which is a very common one.
Right.
Persistent sadness, not being able to sleep properly, not enjoying your work, those kinds of symptoms are there. Sometimes there is anxiety as well, because you are so used to being connected to people, and when suddenly you are alone, no matter how old you are or how much you are capable, you still feel that now this is a big change. How will I manage? Who will look after me? Will I be able to do my work? So that anxiety is there. There may not be sadness, but the anxiety, uncertainty, that makes a person prone to develop a lot of anxiety disorders. And as I was saying earlier, to cope up with all this, the person could use substance as well, and then you don't know when a small little bit of a use turns into an addiction or dependence. So that is also an example of an illness that can mental illness that can develop in isolation.
Okay, all right. So humans naturally, obviously, they are always looking for social interactions. I mean, even a newborn baby, for that matter, the touch is so important. But it seems like social isolation, it's become a common problem if somebody is not enjoying people around them, and it remains an issue. So why? So it. I mean, one it can be a forced isolation, which is like COVID or something like that, physical forced isolation. But one could be like a person is isolating themselves. So what is actually the difference between the two, and also like why or what are the factors that actually cause the involuntary solitude?
So, I mean, it depends on the reason. I mean, if you think of people who are isolating themselves, if you see
that's
that if you think of people who are isolating themselves of their own free will, that could actually point towards a mental illness. I mean, if a person is suffering from depression, has started suffering from depression or any other mental illness, one of the symptoms of mental illness is social withdrawal. Whether it is depression, whether it is substance use, whether it is something even more serious like schizophrenia, that the symptom of the mental illness itself is social withdrawal, and that could if a person is withdrawing and not talking to friends and has changed his habits, that could mean that he is already started suffering from a mental illness, and that needs to be looked into. And in the other on another if the other you see from another perspective, and a person needs to isolate himself for some particular reason, whether it is it's work, it demands him to isolate, whether it's let's say it's a medical personnel who knows that he is so closely associated with infectious diseases, and he needs to isolate himself to
Right.
protect his own family, not because he is sick, but because he might be carrying the particular microbe which could infect his family. That could lead to a sense of guilt as well in a person, or a sense of frustration that I am not able to see my loved ones just because, not because of any fault of mine, not because I have a disease, not because I have been imposed with some isolation, but I have to do it, and it's essential to do it. So that results in a lot of guilt and frustration as well. So I mean, isolation can be for a variety of reasons, either ways, it's going to no matter whether it is voluntarily taken up, whether it is involuntary imposed through a lockdown. Either ways, it is definitely going to have an impact on the mental health of the individual.
No, you're so right about that, Dr. Sujoy, because I can relate it on a personal level with my father being in a long term care nursing home facility. And with COVID, it was so difficult because, and again, it is for the safety of for all the residents over there that nobody was allowed to come in. And but what it did from the residents and all the seniors' point of view, that it was so hard that they were forced into this, um, in this kind of a situation. So definitely, COVID has the world has had to face some really major issues because of the COVID pandemic in the last year. But it is equally important for us to emotionally support each other and do the best whatever we can in the circumstances. So, what are the strategies for people at home to cope up with long periods of isolation, and especially, I would say, in the COVID-19, like I'm in this kind of particular scenario, even though it's opening up, but it's not 100% there, so people still have to cope up with that isolation piece. So how do we still learn and use some of the strategies to deal with that?
So to cope up with the isolation, see, the isolation is an inevitable thing. It has happened. It has had to happen. But as I was saying earlier, you're really not never completely disconnected from people because you have virtual means like internet and all that. So make the best use of it on a regular basis, talking to friends, family, whatever, internet, phone, video, audio, doesn't matter. Whatever you have to make contact with people, and then to ask you feel a sense of reassurance as to how they are. They ask you how you feel, so you feel a sense of being cared for. So that is quite important. So keeping in touch as much as is possible. As I said, the real human face-to-face physical contact is the best thing. But still, if there has to be a substitute for this, so be it. That is the first thing. Secondly, it is good to have knowledge about what's going on in the world, like what are the COVID restrictions in my area, I would like to know, or what are the advisories being issued by the government, because it is important. I was mentioning earlier about anxiety and worry about uncertainty. So if you have good news sources, reliable news sources, which can tell you what's going on in the world, you will feel much less anxiety. So to consume or to understand, watch news in a very balanced way. You do not have to watch. I mean, it only makes you more anxious to see things like what is the death toll and how many more people are admitted in hospitals. Of course, that statistic is always there, but rather than that, focusing on practical things. What are the COVID rules? What are the new advisories? What are the home tips that the government is saying that you should do? Which helpline to call? Those kinds of things. And finally, the third thing is that after isolation, you always have a disruption in your routine. Before isolation, you would always have set routine. You know that you get up in the morning, go to work or wherever it is that you go, see some familiar faces, come back, and there's a set routine. You know what to expect in your day. But when you have this isolation, suddenly you're thrown into a totally different routine. Now there are no familiar faces to see. Work may be from home, or you are not able to work. So you should try to make a routine for yourself, that whether it is from getting up in the morning at a particular time, keeping some time for exercises, keeping some time for leisure activities, keeping some time to communicate with your friends, and keeping some time for work, of course. So if you have a predictability and a routine, it makes life much easier. It will be difficult to change from the earlier routine to the current routine, but at least some kind of predictability gives you control over your own life, and you would be less anxious. So these are some of the things: contact with friends, consuming news in a limited manner, and setting up a routine. I feel that these things could be quite useful in the times of isolation.
Yeah, so we all know that this past year and a half has been really very unprecedented with the global health crisis that everyone is facing. So, We Serve Canada is trying its best to come up with small need based programs, coming up with these small tips with Dr. Sujoy Ray. And it has been actually a very insightful conversation. And also, small things, which is actually going to take us a long way and help us to be mentally strong and healthy. So thank you so much, Dr. Sujoy, for being part of the We Serve Canada Community e-talk and giving us these wonderful strategies and tips on how to deal with our mental well-being. Thank you.
Thank you so much. Thank you.
Thanks.
That wraps up this week's episode. Thank you to Dr. Sujoy for providing some insight on how isolation can affect our mental health. Stay tuned, everyone, for next week's episode, Newcomers and Immigrants in Canada. Please give our video a like and comment below if you have any questions. We might answer them in our next video. To show your support for our channel, we greatly appreciate it if you click the subscribe button and notification bell. That way, you'll be notified the moment our next episode is posted. Be sure to follow us on our social media at VServe Canada to become part of the community. See y'all next week!